Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill Smith.
Welcome back to the FIRRIMup Doctors, Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
All right. Happy Thursday and welcome back to our FIRRIMup Doctors webinar. As usual, this is our Kick COVID-19 to the Curb, and I'm very happy to announce that we are now on 3 websites for our ebook. These 3 are Amazon Kindle, Google Play, and Barnes & Noble Nook. It's going to be $9.99 on every website. The paperback will be $29.99. But you can find that either by going to the website and typing in Kick COVID-19 to the Curb, or you can go to our website listed here, FIRRIMupDoctors.com, and on there you'll be able to find links to each of the resources we have. And now I would like to welcome your FIRRIMup doctors, Dr. Angela Yakey and Dr. Kathleen O'Neill Smith, and they're going to talk a little bit about going back to school.
Everybody, I can't believe it's week 21 already, Dr. Kathleen.
That's amazing. Absolutely amazing. When you look back, time flies, but it has been a long haul.
Yeah, I'd say some people are getting COVID fatigue. So I actually have kind of group visit supports about like, we're in for a marathon and it's not a race, as you always say, as an Olympian.
Yeah, it is a marathon and just one day at a time, right? That's all you can do is one day at a time.
Yeah, so it's kind of thunderstorming here in North Central Florida. So if I cut out, I want you to keep going from Boston. It's only because we lose the internet, but
you got it.
Yeah. So we're about to start a new school year. So we thought it would be appropriate to talk about children and COVID and then issues of returning back to school that we've been seeing in our telehealth meetings. So yeah, and I think Emily told you that our guidebook got on Amazon. So we're finally on Amazon Kindle. We're really excited about that so we can have more of a worldwide reach. So our ebook is now on Amazon Kindle, Google Play, and Barnes & Noble Nook. Yeah, we still have some paperbacks available as well in both Dr. O'Neill Smith's and my private office. So look at where we started, March 5th. Next slide. And here we've had quite a bit of penetration now, especially along the Eastern Seaboard. We're busy here in Gainesville taking care of a lot of COVID patients, actually. Next slide. So we'll give you the updates. Overall in the United States, 4.8 million confirmed, total tested, we're 59 million already. 158,321 deaths with over 1.6 million recovering. In Florida, we've tested 3.8 million, 500,000 confirmed, hospitalized about 29,000 and 7,627 deaths, unfortunately. In our county, Alachua County, North Central Florida, we've had 3,862 confirmed, 25 deaths. And honestly, I haven't gotten a chance to tally. I've been so busy. In our 6,000 patient practice, we're over 20 COVID patients. Our protocols that I want the people in Gainesville to know about in my private practice. If you're COVID positive, we actually see you every single day on telehealth. If you're a person under suspicion, i.e. your COVID swab's pending, or if you were COVID negative, but yet you've lost your taste and smell, you've got the weird chest pain, you can't breathe quite right, and I think you're actually COVID, even though you have a negative RT-PCR test, you're called a PUI, person under investigation, and we treat you the same way. We give you options for daily check-ins, and knock wood, we haven't lost anybody. We've only had 2 admitted. Nobody was intubated, and those 2 are actually recovering quite well. So thank God things are going pretty well, but super busy here in North Central Florida. How's it going in Massachusetts?
Well, in Massachusetts, we've got a little uptick right now. And I think there's a lot of concern about the students. We're going to increase our population by 10%, maybe 15% with all of the college students coming back within the next couple of weeks, next week and the week after. And I know that there's a request from the task force here in Massachusetts to actually for all of the colleges to go online, because
Wow.
Northeastern is not online, BU is not online, Harvard will be online. So I don't know all the details of that, but I know that there's a lot of concern. So that's unfortunate, but we have a few more, 1,000 more deaths than you have. And I know just in general, if we look at the big picture, since this all started, there have been nationally about 1,000 deaths per day. You know, when you think about the 158,000 plus deaths, it's been about 1,000 deaths per day over the 5 months that we've been dealing with COVID. And it's really amazing. It would be great for the whole country to get down closer towards 500 deaths per day. I'm busy not so much with positive COVID patients presently, but just handling the aftermath and some of the adults. So I don't have any children who have tested positive. Actually, we have college kids who have tested positive, but they have not been sick. We have mostly anywhere between 35 and 65 years of age, people who have tested positive, and most of them have gotten better, but some of them have sequelae, some, palpitations, some racing hearts, some, we call that SVT, tachycardia, heart racing, things like that. But generally speaking, they're being managed. So I hope that the number of deaths in your practice can remain really low.
Yes, me too. So basically, speaking on that note, we will, it hit Boston sooner than us, so we'll be dealing with the sequelae later. And I had just read a review article that 1 in 3 people actually have, a third of the people do have kind of post-viral syndromes like chronic fatigue, brain fog, muscle aches in terms of sequelae. And we could certainly do another talk on that. But today there was a question in the chat about sequelae. We did one briefly only 2 weeks ago as well, so it's on our archives. But you're actually living through that now, Dr. Kathleen, because your peak happened 2 or 3 months prior to ours.
Yeah, people are scared. People are very scared when they continue to feel the sequelae. The smell and taste have come back for a lot of my patients. It takes some time, but I think really probably the more prominent one is fatigue, brain fog, and this heart racing. Not really sure what happens in the heart. I've got a couple of patients who are under evaluation with Holter monitors, et cetera, but it seems like an SVT. It doesn't seem like an arrhythmia. So we'll see.
Yeah, well, we know that some reports of SARS-CoV-2, the virus that causes COVID-19, it affects the heart 20% or more in some other studies. So, wow, keep us tuned to that. Thank you.
Mm-hmm.
Next slide. So here we are in Alachua County. A lot of our listeners are from Alachua County, so I thought I'd share this with you. New hospitalizations aren't that high, 19 within the past week. But again, let's look at this Alachua County case fatality rate. It's still 5 out of 1,000. It's not too bad at all. But, given the sequelae discussion, I would still be holding out and avoiding trying to get COVID-19 to get it over with.
Oh, no, we don't want, yes.
I'd hold out for the vaccine or something else.
Yes.
Or if you get it, hopefully you're fortified and you won't have severe illness. Next slide. So here on to today's topic. We're about to start school. How does COVID-19 affect children, and how do we prepare children to go back to school? So this is the FAQ for this week. So we thought we would tell you basically some bullet points about a very rare condition in children. It's called MISC, which stands for multi-system inflammatory syndrome in children, MISC. So first, I will tell you it's extremely rare. The incidence is 2 out of 100,000. And it actually was first reported in April in the United Kingdom. Mostly it was reported in Europe, Canada, and the United States, not at the time in Asian countries. But basically, when you have this, it's an overwhelming immune condition, but it presents differently than in grown-ups. In this study, for example, out of 186 patients, 92% had gastrointestinal problems, 80% had cardiovascular problems, 3 out of 4 had hematologic problems, 74% had mucosal problems, and skin problems, and 7 out of 10 had respiratory problems. And basically, we thought it looks more like this kind of autoimmune or autoinflammatory condition in children that we know about called Kawasaki syndrome, which responds to steroids, interleukin-6 inhibitors, and basically to calm down the immune system. But it is a rare condition, but we thought we would just bring it up because we are going back to school. But it apparently actually affects even totally healthy children.
You know,
Any comments on that, Dr. Kathleen?
yeah, I know it's rare. And one of the things that I'm thinking about with respect to this multi-system, so all these systems that you see that are involved, I bet that the central hub for these systems is the gut. And you can see that that's the highest percentage of symptoms that the children feel. I think it may be related to the microbiome. And the microbiome will be related to all the things that we have in our poster coming up. But I think it's really important to be thinking about, you know, how we sleep, how we eat, our stressors and how we handle stress, and how we move will greatly affect the microbiome. And remember, the genes of the microbiome are exponentially bigger than our genes, our genetics, our human genome. So it's really important to be thinking, keep the gut healthy in children by feeding it well, by being sure that they have low stress. And that's hard. When the parents are stressed at home, the kids feel it. So we have to model and role model for our children, how do we manage stress? And I think we can all do that together. With breathing is one of the best things for sure.
Yeah, that's a good point, that a major barrier is in the gut, and that the doorknob, the ACE2 receptor is not only in the lungs, but in the gut. And so that's a great analysis that an entryway is into the gut. And what are our children eating? Let's go on to the next slide. So we made this poster for our workplace safety masterclass, but we're sharing it with you all about ways to fortify children's immune systems prior to going back to schools. So I'm just going to start with the first in the upper left, some tips here on how to fortify your children's immune system. Eating healthy. So basically eating 10 fruits and vegetables a day. That's 2 large salads and a lot of berries. I know that many children, they did a study that most Americans only get 2 fruits and vegetables a day, and that actually included French fries and ketchup. And so trying to get all those antioxidants and the nutrients, the C, the beta carotene, in your diet is super important, especially now in this pandemic with children going back to school.
Well, I mean, these fruits and vegetables that you see here, they will change the biome. So they will promote, I mean, you can have bad guys and good guys, and the bad guys in a kid's gut will not be able to, they don't do the job of keeping COVID from attaching to the ACE receptors. The good guys that these particular fruits and vegetables will feed do a very rigorous, robust job to keep COVID from getting into the belly. So I would say a little bit goes a long way. I mean, whatever you can have at breakfast, whatever you can have at snack, a little bit goes a long way. So it can be a half a banana at breakfast. It can be 4 carrots, you know, and at snack, and a few cherries at lunch, and broccoli for dinner. But I really do think that we've got to, you know, kind of be sure that we just kind of get in there some of these colorful antioxidative foods.
And I would say also think about giving your children bone broth to make sure the gut's healthy. It is it's very soothing to the gut, but also if there's any leaky gut, it can help heal and seal that gut.
Absolutely. Really important. So fruits and vegetables you cannot underestimate. And sleep you can't underestimate. And a lot of kids, when they go back to school, their schedules are disrupted. Who knows what's going on in school these days? I mean, it would be better for children to be with their peers, but sleep time is really, really key. So, you know, creating a routine around sleep and creating, you know, here's what we do at 7 o'clock, we wash up, and by 8 o'clock we're in bed and we're waking up at 7 the next day, or however it looks, right? But this will keep the microbiome healthy. And it says at the bottom here that attack microbes and other cancer cells. So the immune system, these natural killer cells, will be directly impacted by having adequate sleep and having restorative sleep. So it's really, really important.
And your microbiome has its own circadian rhythm as well. So trying to, if school's going to start, I hear in Gainesville around August 24th, so about 2-3 weeks, you're going to want to start to get your children back into a routine. And children need to sleep longer because they're growing. They have more growth hormone. They need to let their brains rest, and then cutting out the digital right before bedtime so their brains can really rest, at least 2 hours before bedtime.
I would actually take it out of the room. I did as a mom, and I do suggest that because I think it's just better. It's less tempting, and children can't make those kinds of decisions. I mean, they don't understand the impact, and nor should we expect them to. We're the grown-ups, and what we bring in the house is what they eat, and what we leave in their room is what they'll use. So I think that we want to be thinking about that and really setting them up for the best health that they can possibly have, both for themselves and for the teachers that are around them as well.
Okay, and then remember, we've been messaging since March. I think everyone knows this already. Washing their hands for 20 seconds, which is 2 happy birthday songs, or you could sing the ABC song. Training your kids to wash their hands before they go into the classroom. Not touch their nose, throw away their tissue paper, just the basics on hygiene.
Yeah, I heard some data that 91% of people pick their nose, and that basically introduces a lot of germs into the airway. And obviously, once they get into the airway, they can create a biofilm in the sinuses or in the nose, and that can then obviously through postnasal drip be swallowed into the gut. So it's really important to, just help the children understand, keep your hands away from your face as best you can.
It's a good point. Okay, and clean eating, we're back to clean eating and healthy switches or swaps. I doubt anybody would go for broccoli over a candy bar, but yeah, you get what we're trying to say is cut out refined processed foods as much as possible right now. Next slide. So I also spent my day doing consults on school administrators and teachers who are yellow, meaning medium risk, middle-aged with high-risk conditions, or high risk, over 65 with high cholesterol or high blood pressure, and did 6 of them today. One's going to retire early as a teacher because she's high risk. The other, I'm trying to make accommodations so that they can work from home, which is what this grid says is, if you're high risk, either consider stopping work or work from home until one of 3 conditions happens. Number 1, a safe and effective treatment. Number 2, a vaccine is found. Or number 3, herd immunity is obtained. I read something about herd immunity in New England Journal of Medicine this past week, that this particular article said it's going to be 2.5 years for that. So I'm holding out for the vaccine. Prior to seeing all the sequelae, I was honestly, when I was down for my birthday thinking I had COVID in April, I was disappointed I didn't have antibodies. But at this point, I prefer not to get COVID because I'm seeing sequelae or complications after COVID. So I'm really hoping a safe, effective, sustainable vaccine is actually found. Dr. Fauci thinks it's going to be sometime in January, so we can only hope and pray. Meanwhile, keep fortifying the teachers, the grown-ups' immune systems, as we've messaged prior, and strengthen the children's as well.
I think that there's going to be treatment too. I mean, I think that by January, there'll also be some much more effective treatment available. I know that there are some really interesting companies that are working on RNA, and microRNA, and some of the more very complex type of treatments that we have never seen before. And I'm really looking forward to seeing what they come up with. So that's exciting. And I think that some of the peptides that we've used have been very effective. But I don't know, it really depends on the person's comorbid conditions. So for high risk people, I really do think that if there's a way for them to not be in the mix, until they know that going back to school is safe in the sense that everybody is going to abide by mask wearing and physical distancing, that's really tricky. But for the medium risk people, again, they have to show up and see what's happening. I think the decisions would be made on an individual basis based upon the risk factors of the staff, and then what's happening within the school and how much autonomy the teachers have with respect to maintaining what they believe to be safety within the classroom setting. It's really tricky.
I think that if this is you, I think having an initial conversation with your administration and then making an appointment with one of our team members is really important, and we will help you navigate through it. There's quite a bit of anxiety on both ends, actually. The administrators don't know quite what to do about it. And then the teachers themselves, especially if you have comorbid conditions, you're concerned for your own safety and health. So that should be, as she says, an individualized decision. Next slide. Okay, so there's a question about hydroxychloroquine treatment. Yeah, I will tell you the Henry Ford study that published looked like hydroxychloroquine was actually favorable given early in the course. It also said you want to not use both for arrhythmias. So this week I've treated 6 or 7 COVID patients. Some of them had already been placed on azithromycin, which is an antibiotic you don't want to mix with hydroxychloroquine. But hydroxychloroquine is an anti-malarial drug. It's been used for a long time. That in and of itself, I think is reasonable, but I wouldn't mix it with azithromycin. And like I said, knock wood, nobody's been intubated so far. So if you called me today and you were early and you had a fever and I knew it was COVID, you'd probably get hydroxychloroquine, a loading dose, 400 twice a day, day 1, and 200 twice a day, day 2 through 5, especially if you've had a normal baseline electrocardiogram. I won't be mixing it with azithromycin or anything to increase your likelihood for arrhythmias. But that's the Henry Ford study. Do you have any other thoughts on that? Oh, and don't forget that you have to use it with zinc, because it actually can act as a zinc ionophore, which is opening up the cell to accept the zinc, which is antiviral. So that's what I generally have been doing. Any thoughts on that, Dr. Kathleen?
No, I haven't used hydroxychloroquine in my active COVID patients, and they've done okay. But again, it's an individual decision based upon the comorbidities and other things. I have a wellness-based practice, so I'm not a primary care. And people have called me initially, so we've done other things. If somebody needed, would I don't know. It just would have to depend. It would depend on the patient, but definitely zinc.
Yeah, in an ideal world, nobody would get sick in the first place. Today I saw a telehealth patient whose husband had COVID last week, then she's COVID positive and has barely any symptoms because we put her on the same preventative protocols that we did for the rest of you all, CD, zinc, PRP spray, which is colostrum based, and she's doing quite well, minimal GI symptoms, and we're following her closely. But really, we hope that you don't get sick in the first place. But should your barriers get breached, and if you don't know what I'm talking about, look at our Kick COVID-19 to the Curb guidebook. You can see beautiful pictures of barrier breach, and you feel it if your barriers were breached. It shows you release interleukins, these chemical messengers between white blood cells, which causes your fever, and then it makes you ache, etc. If that happens, then we're going to be a little more aggressive with you in terms of pharmacological therapy, and we'll do the best we can for what we understand is in August 2020. What do you think? Here's a question for you, Dr. Kathleen. What do you think about younger patients with long-term symptoms? Even when there is not a high risk of death, it seems many young people are not recovering months after infection with lung and neurological issues. Not many are speaking about this when restarting work and school.
I'm not sure what younger means. So if you could add in some numbers for younger, that would be helpful. But, in terms of sequelae, I think that it is really important to stay in touch with patients post COVID-19 infection, because I think if they have neurological symptoms and they have lung symptoms, so it would depend on the symptoms, but with lung symptoms, if you haven't heard Dr. Nathan Bryan, with respect to the NEO40 and nitric oxide, that's really important to be looking at. So if young, healthy people now have sequelae that are continuing, I would really, really consider opening up the airway and getting vasodilatation in the airway so that oxygen delivery can be done effectively. And that should help shortness of breath. Some of the other things that I think is happening to the patients that I've seen is that they're dehydrated. So for example, yesterday I had a woman in my practice with sequelae. She's a PhD in psych. And so she came in and we had done some testing on her and she had really low NAD. So we were going to do an IV with NAD. So she was resting in the chair and we gave her a low dose of NAD, but she got palpitations and felt short of breath. We stopped it immediately. There aren't any concerns. That's not a side effect, but that's reflective of her system not being able to respond. The vagus nerve needs to be activated. So we talked about box breathing for seconds in, the count to 4 in, the count to 4 out, opening up the airway. We gave her hydration. So we basically simply hydrated her and her shortness of breath and everything resolved in no time. So that was really important. And I think the tingling in the limbs, again, that's nervous system, but the nervous system is kind of followed, as we know, Dr. Reiki, by the vasculature. So the blood vessels have to be available to keep the nervous system healthy. So in other words, we've got to bring healthy fluid in the blood vessels in with oxygen, with nutrients. We have to remove the garbage, from that tissue as well. That you're feeling the tingling in the limbs. So I think Neo 40 and that kind of a product is really, really important. I think hydration is really, really important. I think, being sure that that the immune system is really boosted and making sure that the detoxification, the antioxidants, glutathione, vitamin C, are, really alpha lipoic acid, that there are adequate amounts of those. And I think that's really important.
Yeah, we just so this crowd knows, we actually have on deck next week, we're talking melatonin, which has some antioxidant properties and also immune boosting properties. And I think shortly after that, we're going to be talking about glutathione as an antioxidant. So I'm glad you brought those up. Mm-hmm. So this crowd might not know what NAD is. Do you want to explain what NAD is?
Oh, NAD is a B vitamin. It's made from nicotinic acid or B vitamin. And the key thing about NAD is that it generates the power in order to move the blood through the body and to move things out of the cell and move things into the cell. So it's part of the mitochondria, the powerhouse of the cell. And it's really, really important to, now listen, here's this question on encouraging young people to go back to school. If it's 30 years old or if it's a college age student, I don't think if people aren't well that they should go to school. I really think that they should opt for online learning. I really think that one of the things that we don't do well as a nation is take care of ourselves and make sure that we've gotten to the root cause and that we've given ourselves adequate time to heal and to grieve even, the whatever we're experiencing symptomatically. So I think it's really, really important that if somebody is not feeling well and if somebody feels, just multiple symptoms, any kind of symptom as a sequelae of COVID, that they do not go back to school.
Exactly. I'm seeing a lot very similar to, where this is a college town. I see a lot of mono and the sequelae of mono and how they're tired. And they have these weird tingling symptoms and it takes a while to get normal again. So, yeah. Okay, so there was a question from last week about nebulized budesonide in treatment of early COVID. Mm-hmm. Yeah, I saw that. There was basically what that's addressing is the COVID lung complications. And basically there's a doctor in California who uses nebulized budesonide, a topical steroid nebulized. And he said that his patients are doing great with their lung complications. Well, the people who have COVID-related lung complications, they do, in our practice, they are getting inhaled corticosteroids either through an inhaler or through the nebulizer. But as it progresses from stage 2 to 3, meaning seriously getting into the lungs, you're getting oral dexamethasone. And that approach has been really, really successful so far. Even in the hospital, as you're approaching stage 3, which is usually day 10, where it affects the lungs, you're getting oral dexamethasone. So yes, that would be a consideration to answer that question. And antibody testing. Okay, so we're running out of antibody tests. Actually, I've ordered a COVID antigen, rapid antigen test that should be in my office in the next 3 to 4 weeks. And I'm still trying, we are sending out antibody testing. We have only the rapids, we only have like 3 to 5 left. So somebody could call this person after this call. Okay, that's what will happen. All right, perfect. Anything else, Emily? Because we're going to start wrapping it up here.
No, ma'am. I think that was it for today.
All right, we so appreciate the 40 people who showed up today and everybody on Facebook. Please like us on Facebook and share our information with your friends and family. This is open to the public on Facebook Live at both FIRRIMupDoctors.com and North Florida Integrative Medicine Gainesville. So we hope you like our material, and please encourage your friends and family to pick up our guidebook. It's now, as we said, on Amazon Kindle as well. So for now, be safe, be well, and God bless you all. And Dr. Kathleen, thank you for coming in from Boston.
Thank you. It's wonderful to be with you all.
Thank you, Emily. Bye-bye.
Thanks, Emily.
Everyone. So before we head out today, we do have a few supplement deals for those that have little kiddos that are sending them back to school. If you go to our Get Healthy website on our FIRRIMup Doctors website and use the code FIRRIMUPKIDS, which is FIRRIM UP Kids, this code is going to be valid starting today until August 20th. And you can get 5% off of the following: chewable omega-3/fish oils, magnesium, vitamin D3, vitamin C chewable, and probiotic chewables. And this is going to all be for younger children as well. You can find these for your age as well, but the deal is only for the kid products right now. Again, if you have any questions, you can always call our office or you can email us at firrimupdoctors@gmail.com and we can try and help you that way. And just like last month, our August special is going to be the same as the July special since we are overloaded with vitamin C and zinc. So if you purchase our guidebook, either paperback or on Amazon, Google, or Barnes & Noble, you can go ahead and take 20% off of the vitamin C and the zinc. You do have to show proof that you purchased this, which will be through either a paper email or a paper receipt or a emailed receipt that you will find from either of the online stores. And if you have any questions, again, you can always email us at firrimupdoctors@gmail.com. You can always call the office, and you can find out a lot more info on our website, which is firrimupdoctors.com. Thank you again for joining us every Thursday. We'll be back next Thursday to talk about melatonin, as Dr. Iki said. But for now, have a great rest of your day and have a good night.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMUPDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.